right. Welcome back to All Things Odd. We have been gone for quite a while, for about a month. So we wanted to kind of spend today just giving you updates from the hood and make sure that you knew what we were up to and what we've been learning and experiencing. So before we get there, while people are coming in to join us, we're going to talk a little bit more about our YouTube channel real quick. So I'm going to put that up and have Dr. Galloway talk about that.
Yep, so if you go to our YouTube channel, you can see all of our previous videos. This is a good place that you can share videos from to someone that doesn't have social media, or if you miss us on a Thursday and we're not here, you can go and find an old video to watch. Oldies but goodies, lots of good topics there. So yes, you can subscribe to, and then it'll let you know when we have a new episode.
Awesome. All right. So we are going to kick off today by just kind of catching up with what we've been doing in September. And we're going to start with Rebecca and just kind of share what she's learned and experienced in the month of September.
Yeah, thank you. So it was really exciting at the beginning of September. Got a chance to go down to Lone Tree, which is where Cochlear Americas has their Denver-based facility. And one of the neatest things that we got to experience down there is that Cochlear is launching their new Nexa device. So usually when Cochlear puts out a new device, they're usually updating the processor, but this time they're actually doing both, updating the processor and their internal implant. So it was really exciting to learn about that. And just for everyone that's watching and may come across this, they're doing some really great things. They released essentially the smallest and lightest sound processor that's currently out there on the market. That was a big push for them. And part of it being lighter and smaller is that they also have a longer lasting battery life, which sounds interesting because how do you get a longer lasting battery? By making things smaller. Doesn't usually happen that way. But what they've done between the new processor and the new implant is they're changing the way that the battery life requirement is used. So what they've done with the implant is they've actually added a chip to it, which is kind of revolutionary and brand new. And through adding that chip, they're able to do a lot more things, not only extend the battery life, but one of the cool things that they're doing now is that the implant itself can have a stored memory process. And so what that means is that when patients come in and they get their maps, which used to just be exclusive to the software and the processor that they were wearing, it actually now writes to the memory on the chip inside on their implant. And so how that works functionally for patients, which I thought was pretty amazing, is that if you have a patient that loses their processor, they no longer have to come in and get to the office and get things reprogrammed. We can actually send them a unwritten processor, and all they have to do is put it up to their magnet, to their implant, and it will write, and they can use it. I think they said within 30 seconds, maybe less than a minute, for it to connect through that smart sync. So I thought immediately, this is great for anybody that's in rural environments where coming in can be a big feat of adventure, especially if you're in winter months and things like that. Traveling gets really difficult. But if we can just ship them a processor, how much easier it is for them to get back on air and be able to hear. So that was a really, really unique thing that Cochlear is doing. The other really cool thing about that is because there's a chip inside, they now can have exclusive firmware updates to that implant. They'll still have to come into the office for that. But the nice part is that in the past, Cochlear had to make their processors kind of retrofit to older implant devices. And now with this new implant update, they can create those firmware updates on the implant itself, making it more streamlined for any future innovations that Cochlear comes up with. Mm-hmm. So it's pretty cool. They'll still be called the nucleus, and they'll still be called the Kanzo in terms of the one that sits on the ear versus just the mini processor. They'll just have the Nexa name now. So this will apply to any newly implanted users going forward. They're going to be using that Nexa implant and the Nexa processors. So it's really exciting, and it was really great to kind of review how Cochlear performs their implants, how they prefer to do it, and just learning with all the other professionals there about kind of what what's coming up. And it's always exciting to know that Cochlear is really doing research-driven improvements in their devices. And then I know Dr. Galloway has some really good comments to talk about what she gleaned from Cochlear and how programming the devices themselves has changed.
Yeah, so and now that I've been an audiologist for almost 10 years, it's been 9 years, it's been really interesting to see, one, how the tech has changed, how the programming recommendations have changed. All of it has changed really significantly in the last 10 years. And with this new implant and processor, they're continuing to kind of I guess I would say streamline their recommendations for professionals. So 10 years ago, whenever I went to the trainings, they taught us, to activate the implants a certain way and use a certain process. And that has all totally changed. And so even since last year, when I went to the training, in this last year, they have even more streamlined the sort of optimization recommendations. So 1 to 3 months post-op, after we've kind of understood how the charger works and we're wearing it every day and we're kind of getting into it, they have some more defined recommendations of things that we can do as a professional to ensure that, the patient is getting the very most out of their device. So it was exciting for me to see, one, how it's changed in 10 years, but even since last year, we used to use a different method for activation or mapping. Now it's called population mean method. So it's just a different method of mapping the device, but it leads to patients having more success sooner because they're able to get more sound kind of right out of the gate. And then for me, it was nice to learn about, what we're calling the optimization period, or this 1 to 3 months post-op, where we've gotten, a lot of the questions asked, and we've learned how to use it with our phone and all of that. But just being able to verify, yes, they're getting the very best results from this that we, could possibly get. And if they're not, how can we, go in there and optimize it for them to make it better? So it was cool to just see everything new. And I think it's really exciting for the future, thinking about if you had a child that's going to get a cochlear implant. Well, now they can, update the actual implant inside their head instead of just rely on, lifelong processor updates. So it's the world's first smart implant. And I think that's really exciting just to know that we'll get to work with that and kind of see how that carries through for our patients.
Yeah, very cool. Very cool. All right. Well, I'm going to have Dr. Galloway talk a little bit more because she just came back also from Austin, Texas, and she was at Oddboss. So I'll let her tell you a little bit more about Oddboss and what she's learned.
Yes. So I went to the Oddboss conference. It is a conference that's put on by a good friend and colleague of ours. We first went to, the first year of it was in 2019, and Dr. Phillips and I went, but we did not own a business, and we were just going in support to learn about audiology. Dr. Phillips was more in like a decision-making role in our previous practice. So a lot of the things applied, but we did not go there thinking we were going to be business owners in the near future. So it's kind of near and dear to our heart because we went there in 2019, met all these friends, lots of people we've known for a long time that own their own practices. It's a private practice group. And then fast forward a few years and we ended up owning a practice. And so it's kind of full circle just to go back every year because we see the same, friends and practice owners, and we get to do a lot of networking. But a lot of people there also own really small practices. So it's nice to be able to bounce ideas around and, how is new legislation affecting our practices, or how are new, financial or insurance things affecting our practices, and kind of bounce things off each other because a 5-person office is much different than a hospital setting or something like that. So it was in Austin, Texas, just for a few days. And really the highlight for me was networking because you get to catch up with all these people. They know our story as far as that we didn't own a business. We kind of, on a whim, opened our own practice. And so I feel like there's a lot of people there really rooting for our success. And I hope someday we'll be able to do a presentation there of just kind of like our timeline and, how things have evolved for us with our practice. A lot of the vendors in audiology and the manufacturers are all present. So, Oticon has a table showing all of their new products and kind of what's coming down the line. Same with Starkey and, the other manufacturers. I always enjoy getting to look at all the products because we have equipment in our office and you don't replace it often, but it's nice to actually look at the new devices. So like MedRex had like a new video otoscope that's really tiny and really high definition. And so just kind of getting to put your hands on things. I actually looked in my own ear with it. So that was an experience in multiple ways. I don't usually put an otoscope in my own ear, but I got to see the definition and, you know, just kind of what's coming out for ideas of things that we could buy, you know, for our practice in the future. But the big highlight is the networking, you know, getting to put our heads together and talk about different issues that our profession is facing and how that's going to trickle down to our private practice or kind of what we can do, you know, to get out of something that might not be a good change for private practice. Mm-hmm. So it was 3 full days of fun and networking and learning. So it was good.
Awesome. All right. Well, and then I am going to give some updates from Spain. And I know some people are like, what? Actually, I was gone for about 10 days and I was in Spain and I ended up with a bunch of ladies just kind of walking the Camino in Spain. So I'm going to put this picture up here. I don't know if it's coming up. Yes, there. Okay. So these ladies here, I just wanted to share. Let me get some, see if I can get some writing off of Rebecca's face there. There we go.
It's such a cool trip. So cool.
Yeah. So it was a lot of fun. If you are in the audiology world, oddly enough, I would say at least maybe 10 of the 14 of us were audiologists. And you can recognize some of them in this picture. If you know some of them, they are former Starkey employees, or some of them still work there. I've done mission work with a lot of them in different countries. And the woman in the front, Lisa Randall, was the one that put together this group and said, hey, I'm going to be walking this walking the Camino in Spain. And I had no idea what that meant. But when I started to see all the ladies that were joining up, I thought, you know what, I'm probably going to try this and I'm pretty sure I can do it, you know? And so we trained for about 9 months. I took a couple of my girlfriends from here. And then one of my best friends that's right behind me, Tiffany White as well. And she's a former audiologist as well. But yeah, we had a great time. And so we basically what it is there are different paths to Santiago. And in Santiago, there's a plaza and a cathedral that you end up no matter what path you take. And if you walk at the moment, if you walk the last 100 kilometers and get to the cathedral, then as a pilgrim, you get this certificate. And of course, you know, competition and what I get proof that I've done this, like I was all in. And so I know they're changing it so that way not the whole last 100 kilometers is as busy, but we basically walked the last maybe 115 kilometers together for 6 days in a row. And so we were able to do that. And so it was a lot of fun. I'm going to see if I can get a couple of other pictures up here just to kind of show you what we did. Let me see if I can find it. This is what some of the paths look like here. And sometimes it was, you know, nice and shady. Sometimes it was hot. There were lots of rocks, lots of hills, a lot of different things that I didn't expect because I was just worried about trying to get my miles in to be able to walk 10 to 15 miles a day without dying. And I wasn't really concerned about the terrain. But we had lots of great conversations. Up ahead, you see 2 people that were in our group, Wendy Grant and Jane Asperinio Brian. And then there's a bunch of people kind of up on ahead, and you can kind of see that some of the different things that we would do is along the trail, you could stop and get stamps along your passport, or basically like, you know, you had to, in order to walk and get your credential at the end, you had to get at least 2 stamps a day. And again, finish that 100 kilometers. And so that little bunch of people up ahead on that path, that's what they're doing. So every so often we would kind of come across that and stop and decide to get stamps. Sometimes they were kind of fun stamps and they were wax, and you stand there and they melt, you know, wax, and they put a little stamp on it and everything. So we were able to do that. And then the last one I'm going to kind of put up here on the trip was kind of the end, where we ended up in the plaza that I was talking about, and that's us, all 14 of us, with our credentials. And so we all, finished and were able to get everything stamped. And that is a beautiful cathedral in the back that we ended up. It was like pretty surreal when you walk in. You walk into this plaza and they're playing the bagpipes for you. There are other pilgrims that are there. They're sitting down, lying down, just staring at the cathedral, crying, laughing, celebrating. And so it was a really, really, really cool experience. But the fun thing was that actually I was with a bunch of audiologists. And so because of that, I'm going to leave that up and give a few information and tidbits about Spain, because I thought I would look it up for this show with our updates. But okay, so I looked up some information about hearing loss and audiology in Spain, and I thought it was kind of interesting. And so in Spain, it's estimated that 5 million people have a hearing loss, placing Spain as the country as the 5th in Europe for hearing loss prevalence. For us, just to give you kind of a comparison and a look, is while they have 5 million people that have hearing loss, in the US, we have 50 million people. So 1 in 7 people in the US that have a hearing loss. So that's just kind of the differences that we're seeing there. In Spain, fewer than 40% of Spaniards with hearing loss actually use hearing aids. And so that's the penetration market, right? And in the US, compared to 40% of Spaniards that are using hearing aids, in the US, 16%, ages 20 to 69, are using hearing aids that need them. And 30% of people aged over 70 years are using it. So although we have 45 million more people, we have a lot less using hearing aids that actually need it and have a hearing loss. So I thought that was kind of interesting, which is why we as audiologists are working tirelessly to try to educate, reach people, spread the awareness, and even with Spain having a lot less people, we are still having to cover a lot more ground to get that percentage rate up. So 16% penetration in the ages 20 to 69, and only 30% over age 70 are using hearing aids in the US. The other thing, since we talked about cochlear implants, is that with cochlear implants, they say that there's a lot less usage of cochlear implants in Spain for many different reasons. Sometimes it's the awareness as well and the information that gets there. However, their percentage is 5.7% that use cochlear implants. So then you think, okay, well, what is it in the US? Well, the US is 6%. So if you go by percentages, that's not a lot of percentage. But again, if you look at the 50 million people that we have in the US that have hearing loss, I mean, we don't know who is a candidate for implants in the US versus Spain, versus the 5 million in Spain. The percentage is, the number of users are very different, right? So I thought that was kind of interesting. And then the last thing that I had found regarding audiology in Spain that we thought was interesting, and Rebecca and I had talked about this a little bit earlier too, is the audiology education. So we've been on a show and we've talked about how we as audiologists in the US go through different schooling, right? And again, from top to bottom right here, the 3 different audiologists, we have 3 different ways of how we got our degrees and how we are currently getting our degree, and how it's evolving. And what's interesting is, like, for us, there's the undergraduate, and then there's the graduate work into the doctorate, right? And then you've got the work in the clinic, and the 3rd year you're going out for your 3rd year, and then your 4th year is the full complete 4th year, which is why we have Rebecca for a year. But the audiology education in Spain is very interesting. What they have is vocational training that's available, and that's been available since 2001, and it's the standard for hearing instrument specialists. And then the first university degree was available in 2023, in 2023 only. And it's only a bachelor's degree in general audiology. So I thought that was pretty interesting. I don't know if that has anything to do with, we look back at the stats that we talked about earlier today, right? But I just think it's kind of interesting that the first university degree for audiology was in 2023, and it's only a bachelor's degree. So we thought that was kind of interesting to just kind of share some different stats from, the different countries, since I spent some time in Spain, and just kind of give an update basically of what we've been up to, because we haven't been here lately. But we have been really busy in September. So if there's anything else, I just wanted to say hi to everybody. We're back. Hopefully we can kind of get back on a regular schedule now. We've just been traveling a lot, but learning a lot and experiencing a lot related to audiology. And we wanted to kind of pass on what we've learned. Anything else?
Nope.
All right. Well, thanks for tuning in, and we will be back next week. So we will have a new topic ready for you, and we will see you guys then. Thanks for joining.
Thank you.